Welcome back to the Disaster Podcast. We have a great group of people for you to discuss one of my favorite subjects, and probably yours too, is social media. This is Sam Bradley, your host for the Disaster Podcast, and I'm going to jump right into this because we have a lot of good things we want to talk about. To my left, we have Stacey Arneson, Tamer Hadi, and Elizabeth Hart, and I'm just going to let them introduce themselves, where they're from, and they've been doing some lectures here. We want to hear about what they discussed with other folks today, and we have some actually current news going on here. We're pretty excited to find out what's actually happening at this moment. So Stacey, why don't we start with you?
Sure, thanks Sam. My name is Stacey Arneson, and I'm with the Disaster Information Management Research Center, which is part of the National Library of Medicine. The National Library of Medicine is one of the institutes of the National Institutes of Health, NIH, and part of the Department of Health and Human Services. And a lot of people don't think about a library in terms of disasters, but we do have a wealth of information specifically for disaster medicine and public health, some of it for preparedness, some of it for response, and of course for recovery. I can talk about more of those later.
Hi, my name is Tamer Hadi. I'm with the New York City Department of Health and Mental Hygiene in the Office of Emergency Preparedness and Response. And so my role at the summit this year was to discuss social media monitoring for ICS, and so how to integrate social media monitoring into your incident command system at the agency level, at the local agency level. And so really the approach is a free to low cost approach rather than relying on some of these really expensive brand management social media tools. So with a little bit of resources and dedication, you could integrate social media monitoring into your ICS and inform some of your leadership on things going on in the social media world.
Funny you should mention that, because as we speak, Elizabeth just joined us and said that's what she's been doing all morning, is tweeting a current event. Why don't you tell us about that?
Absolutely. Well, hello to everyone. My name is Elizabeth Hart. I am the Public Information Officer for the Shelby County Health Department located in Memphis, Tennessee, and I am responsible for all things communications at the Health Department, everything from external communications, internal communications, but of course social media. And as you just mentioned, we are currently in severe weather in Memphis, Tennessee right now. And so as of this morning, actually last evening, I was tweeting all the preparedness tips you need to know in advance of severe storms, about making sure that you have your flashlights readily available with the batteries, as well as making sure that your cellular devices are charged. And of course, the all important, making sure that your family has their emergency plan and that you've discussed it with them.
Now, when you're doing this, are you reaching mostly out to the public? Is that who you're...
Absolutely. Yeah. We have built our social media, especially our Twitter site, about over the last year, and we have a little over 1,100 followers now on Twitter. And a lot of them are not only just the Jane and the John Does, but also the media. And so they have really been our friends when we tweet out information, and certainly just bullet points instead of the old school press releases, of which we still do. But social media is great because it's 140 characters of tidbits of information that were in that press release that then can be retweeted.
And you can actually communicate quite a lot in 140 characters, like, it's right there, duck.
Absolutely. But again, it's about the preparedness, making sure that people are well prepared in advance of an emergency, whether it's a flood or severe weather, or if there's anything else that's going on. That you'd be surprised how many people are on Twitter and Facebook, and especially with the media, they can actually take what we say as a quote on the Twitter account and actually put that into their newscast, which is very helpful when your phone is ringing constantly.
Well, and two, it's so easy to retweet information. So if you see something, say we were in the same area dealing with the same emergency, I could easily get your information out to all of my followers, and that way it can go viral very quickly, and that's a great way to...
And it's important, especially with credibility, to see that the information is coming from not just a regular individual or a resident of the county, but really from the Shelby County Health Department or for your respective health departments as well. Because when they see that their image on your thumbnail of your picture of your profile, then they realize that information is pretty credible.
So do you use hashtags?
I do. We use hashtags on certain events. We don't use a generic one, but it's on specific events. Sometimes we personalize them. For instance, when everyone went Go Red back in February for American Heart Month, we used the hashtag Go Red SCHD, which is Shelby County Health Department, which helped us to kind of filter through all of the red pictures that were on Twitter.
Yes, I can imagine. Wow, that's exciting, and I really hope that we have good results with this impending storm. But I imagine people are paying attention.
They are. They really do pay
I-
attention to us, as well as some of our other agencies in the Shelby County area.
And I follow a lot of the weather channels in our area too, so it is a great way to get really, I mean, you talk about press releases and so forth, which is great, but how many people are reading the paper when they can go to the news, they can listen to Twitter? That's wow. So Hammer, tell us a little more about what you were talking about in terms of your lecture today and how you communicate.
Sure.
social
So
media.
during an emergency, when we activate the incident command system, basically we wanted to take advantage of all the wealth of information on social media, particularly in New York City, where it's a very dense environment and there are tons and tons of social media users on the ground. So especially in a localized incident, you're going to have all these basically freelance journalists out there doing work for you. And then they're also going to come up with questions and confusion around the incident. And so if your agency has a role in that emergency, it's really important to pick up on those trends and try to put out messaging that kind of answers those questions or rumors or concerns by the public. Every agency, every agency is going to have different reasons for monitoring social media. So from a public health standpoint, in addition to situational awareness, you want to also monitor for how effective your messaging is, your outgoing messaging. So if you put out a press release, traditionally, you're going to get questions regardless of how good that messaging is. And so a lot of those questions are going to pop up on social media. And so you can, address the questions and put out more effective messaging based on that. But also there's a new trend developing in public health using social media for like supplementary disease surveillance. So you may pick up on trends of people talking about being ill if something is going around, and if things kind of go above the background, it may be something you want to look into further.
Wow.
It's still an emerging field. It's not really proven yet, but there are some actual articles on how influenza can be tracked with really precise effectiveness, even better than some of our own built-in surveillance. So it's really interesting to be honest.
Well, and you made a good point about how do you determine your effectiveness? Do you look at the number of retweets that are going out, or the number of questions that are coming in? How do you determine that effectiveness?
Yeah, retweets is definitely one metric you could look at, but I think if it's not fully addressing the concerns, a lot of questions are going to pop up. So actually, if it's quiet, that's probably good. If it's a lot of replies and questions, then you know that there's still something you need to address. And really, our social media function falls under the PIO, which just kind of makes sense. And so it's at the discretion of the PIO to take the information that the social media monitoring team gathers and how to put that back out to the public.
Well, it's interesting that he brought that up because a couple weeks ago we had an issue in Shelby County, Memphis about tuberculosis, and we were monitoring what was being said. And so because of what we were monitoring, we knew what was going on obviously behind the scenes, but we were able to then take some of the information from our frequently asked questions and then put that on Twitter, and we used the hashtag TB101 because there were a lot of questions of what is tuberculosis? I thought that was an 18th century disease. All of the usual questions that those of us in public health hear all the time about tuberculosis. And because of the monitoring that we were doing, and really we weren't using a monitoring such as what you all are doing. It was more or less I was looking at some of the timelines of what people were retweeting that I realized that there was a lot of conversation going on. This is a great opportunity. It's a teachable moment because people had so many questions to then address their questions and answer them. And as you mentioned, it did quiet down once we started putting those things out and we started realizing everyone was using the hashtag TB101, and we were seeing a lot of the retweets, and then thus the conversation kind of sizzled out.
And Stacey, I want to get back to you in a minute, but this raises another question for me. When you see there's a lot of, and the point of using a PIO is to make sure you're getting standardized information, you're giving accurate information, so hopefully the people are paying more attention to you, but there's every opportunity for misinformation to go out there, in fact even public hysteria. How would you guys, if you saw that happening, how would you quell that? in hopes that people were paying attention to you.
Well, that's a great point. I know that's part of the reason why I monitor it. I not only monitor it on Twitter, but also on Facebook, because a lot of the media, your ABC, your CBS, your NBC, Fox affiliates are all on Facebook, and every time they do a story, then they post it. And we all know about those infamous comment sections of not only their websites, but on their Facebook. And so I do monitor that, and I see what individuals are saying. And if there's a lot of negativity, that's an opportunity. And I know we always use the term teachable moment, but that truly is a teachable moment. So look at what they're saying and then be able to inundate them with the correct information. We'll then go on their Facebook page as the Shelby County Health Department and say, hey, come over to our Facebook page where we have a lot of great information. And of course, we've since picked up great followers both on Facebook and Twitter.
Yeah.
And then if you have a nice network of people that would retweet your message, then you're going to start getting the right information.
Exactly.
But rumors and misinformation is key, right? Like even the best news outlets might get something wrong or say something a little bit.
No.
I was trying to be nice, but they might get something even just a little bit wrong, and that could be really key. So you need to monitor what they're saying about you. And if there's an error, that PIO can reach out to the press and make sure that it's correct.
You're right, and it's not that the news does that intentionally. It's just they want to get information out to people, but they may not have enough information to really know what's valid or what's not, because where are they getting it? They're hearing it from other people. I mean, like you say, you know how you have a top news story that will go through any number of iterations, like when it involves death or trauma to people, how many people are involved. Well, it takes a long time to really get accurate information. So I want to come back to Stacy. I want to know how the library will assist us in getting information. I'm sure as far as the pre-preparedness and that kind of thing, you have a lot of good resources.
Sure, we certainly do, and we have information that's for the general public, and we also have a lot of information that's for health professionals as well. So from our perspective, the broad mission of the National Library of Medicine is to collect, organize, and disseminate the world's biomedical information. And social media is one way we can disseminate it. We have our websites, our apps, and social media is another way to push that information and to push timely information out as people need it, and as to be a trusted resource. We've sort of been smiling as people have talked about social media and credibility and how do you curate the information, because essentially that's what librarians have been trained to do for many, many years and have done that. Yet no one thinks of including their librarian in this, and so I'd like to encourage the two other people here on the panel with me to think about using your librarians in this, because they can help with social media monitoring. You talk about there's a lot of information out there. You have to do searches of that to find out just what you need information, and of course librarians are excellent searchers. In addition, they can help find information. You referred to your FAQs. What if the question isn't answered in your FAQ, or your subject matter expert isn't there? We have the medical literature that the librarians can come back and look at. Now, from a social media perspective, we can see what's going on. We don't always get down to the local level because we're just a small group, but we're now trying to encourage librarians to do this on their own. But we can see what some of the national major issues are, and we can push our information out that we have that would be for the disaster workforce as well as for the general public. And we can make sure that they know about the information that we have. We cover many different disaster topics and of course many different diseases, and we can get that information out pretty quickly, pretty easily, and be just another venue to help the public information groups do this.
So
it's interesting because we on our press releases, when I send information out, whether it's a bullet point, if it's a full-on press release, actually the library in Memphis, because we are split, we are Memphis and Shelby County, the health department is under the county. I actually let the Memphis librarians know.
Great.
And so because the 211 goes through the libraries, and so we actually communicate everything that we do. So it's funny that you mentioned that. So every time we have any kind of bullet, a press release or anything, they are in the know, and they're on my master list of information, and they have my BlackBerry on speed dial, and yes, they do use it.
Oh, well, we'll have to talk after the podcast as well.
We will.
Well, and that was kind of my questions. How do, she's obviously very much in sync with this, but maybe a lot of PIOs don't realize that resource is out there. How can you better connect with them and let them know, hey, we're here to help get you the right information?
It's all really about partnerships.
Mm-hmm.
Honestly, one, because I can't do it all myself. A lot of people don't realize.
Sounds like you're trying, though.
I do try. A lot of people don't realize I am a department of one, so I do everything, and I recognize that I have to sleep at some point, and so I do use our partners.
I was wondering about that.
I use our partners at the library. I use the faith-based organizations, Yes, the Twitter and the Facebook are on my BlackBerry, so if I'm sitting in a meeting, I can oftentimes tweet and do multi things at the same time. But if we wouldn't be anywhere, we wouldn't be as successful as we are without our partners, such as the library and the other faith-based organizations. And so I make the talking points. I might write the press release, and then I send it out to this massive list and say, hey guys, if you have any questions, feel free to call me. And then I filter it through them, and they've become my eyes and ears out in the community.
You are the consummate multitasker.
I am.
Well, all you are,
am.
I'm sure. And when we think of libraries, of course, we think of books, but now the library has emerged into the 21st century to be a whole different resource. That's
Well, and the
really
library is
awesome.
often the first place to get the internet back up and running. And Starbucks will offer free internet, but they don't offer you computers and they don't offer you assistance. And so the libraries have often been places that people will go to get the internet, to have a computer.
Correct.
If you've just been in a disaster, you may not have a computer anymore. And you'll
Very
have
true.
librarians who can help you navigate through whatever system you might want to use, whether it's reporting to FEMA about what you've lost. That has to go online now, so librarians can help you do that, as also helping you with your social media or trying to connect with your family and loved ones. You can do that, and they can help you with that as
Good
well.
point.
On the topic of partnerships, though, a lot of maybe local health departments may not have the internal resources to dedicate to doing social media monitoring because
Good
it is a
point.
bit of a resource heavy
Yes,
requirement.
it is.
Very.
So there's a concept called VOST, or VOST, Virtual Operation Support Teams, and what that is really volunteers in your community who want to help out, and they happen to be
Excellent.
really good at social media, and basically you can build that partnership for them to kind of help you do the monitoring instead of internally, so then they can feed in to you, they can help disseminate your message, but also pick up on those trends that you want to that you need to know about. And so I encourage local health departments to look into that as well as an external support for social media. It's called VOST.
That's an excellent
Let me
idea.
also piggyback us, on with the library. And in Memphis and Shelby County, our socioeconomic status is much lower than the rest of the country. And a lot of the individuals actually go to the library to apply for jobs, to apply for their weekly unemployment, because that's where they have the internet. And so what we do at Shelby County Health Department is we go to where our residents are. And honestly, the library is where they are, because that's where they do a lot of their business. They make phone calls, they can get on the internet, they can make their resumes. And so that's very important in our partnerships with disseminating information. We have a rabies drive that's getting ready to come up in the next couple of weeks. And of course, naturally, where are we going to be? We're going to be at the library. So
Great.
again, we go to where, it's very important you go to where people are, and that you kind of take that back to social media. Social media is the new media. When I first started my career years ago, we did old school radio, and I didn't have the computers and the
We just had
fancy
that conversation.
equipment, and so now we've had to transition into the new media, and social media is the new media. So as public information officers, individuals in communications, we have to go to where the people are and where they want their information, and social media is that.
It's great, and we've also done a couple of things to try to encourage partnerships. One is, I don't know if it's appropriate to mention here, but the past 3 years, and we hope again this year, we've had some small funding opportunities that specifically are partnerships between a disaster organization and a library. And we hope, again, to announce that soon. And we've also been trying to train librarians as disaster information specialists, get them educated about the topic, so they know something about disasters and what to do, and we offer a series of courses that have been taught in person, and they're also available online for free, so that they feel a little more confident and comfortable with the topic, so they can show where they can fit in their communities, because in every community it could be a little bit different, whether it's monitoring or providing information to the PIO. There could be different ways in which the librarians could help, and one of those courses is actually about a seat at the table, so how you can encourage the library and the librarians to be invited to a seat at the table when these discussions are going on ahead of time.
So the seed I'm seeing, or the kind of the underlying factor here, is it's the opportunity to get accurate information out. And like you were saying with your volunteers, and I love that idea, they're getting the information directly from you, so they know that what they put out is accurate information, and the people that get that. So I also like the idea, when you think about social media, you're thinking about what you're putting out, but the whole idea of surveillance is interesting. The fact that you can watch what's going on out there and start, we have sophisticated systems for doing that, but what if they're not online, and that's limited to a certain number of people? This really broadens your horizons and your ability to do surveillance. And that's really excellent, not something I would have thought of.
As we talked, think about the way individuals are getting information these days. We look at newspapers and then unfortunately are going out of business around the country. Everyone has a mobile device, whether it's a BlackBerry, whether it's a smartphone, an iPhone, whatever you want to call it. That's where you're
getting. Or they go to the
library.
library.
Oh, they go to the library. But that's where you're getting your information. And as you talked about credibility, of course, those of us that work in public health, we know to be first, be right, and be credible. And that's very important in public health.
Wow, I could certainly have this discussion all day long, but I can see that there's other podcasts to be done. So Elizabeth, where can they find out more about you and what you do and maybe some of the great information you have?
Well, I would certainly encourage anyone that's listening or watching that to find the Shelby County Health Department on Twitter. We are Shelby TN Health. Shelby TN Health on both Twitter and Facebook. We are very active all day long, and you can get all of my information on there as well, the ShelbyCountyTN.gov website with all my contact information. But I encourage Twitter and Facebook.
And you've done a whole 20 minutes without tweeting. I'm sure you're anxious to get back to whatever's going on. We'll be watching to see what's going on with your weather issue out there. Tamara, what can you tell us? Where can we find information on what you do? You got some really great points there.
Well, so far the social media monitoring thing is not on any public-facing website, but you can certainly reach out to me directly, and I'd be happy to talk about that for days with anybody. But certainly go to our New York City Department of Health website, or you can find us on Twitter at NYC Healthy. And we often talk about emergency preparedness as well on there.
NYC Healthy. Excellent. And I learned so much about libraries. I'm so impressed. So what can you tell us? How can they get more information? You got all the information there.
Well, we do have a website that would tell you how to follow us on Twitter and join our listserv if you're interested. And that website is disasterinfo.nlm for National Library of Medicine .nih.gov.
This was the best ever. Thank you guys so much.
Well,
I wish we had another hour to talk
us.
about this. Oh, we could keep going. But it's the end of the road for this podcast. So we thank you all for being here. This is great information. We hope you dip into some of those great resources out there. This is Sam Bradley with the Disaster Podcast. Disaster medicine is not your everyday medicine. And as they are proving to us, disaster preparedness is everyone's responsibility.